Hi, I'm Dr. Patrick Garrett. As you guys know, I'm a natural medicine, functional medicine type of guy. I have a lifestyle medicine practice, and I'm also the physician for the Cleaning Challenge. Today, our topic is greens. So why should we eat greens? Who cares? Why should we care? And what are they, right? So greens are very powerful things. A big part of what we do in our practice is food is medicine, just like the Clean Eating Challenge. And that's why it's so exciting to see that focus on greens. And while green might not be the most interesting color when you look at the rainbow of fruits and vegetables, but really greens are like the staple. It's the most powerful, beneficial, kind of like a train. It's the workhorse of nutrition. And so those phytochemicals that are in there are very powerful things. You think of like vitamins and minerals and trace elements and flavonoids, right? Phytonutrients are those chemicals. And so there's tons of these in there, and they all have this subtle drug-like effect that influences all the biochemical processes in your body. So what's a phytochemical? Phyto just means plant, right? And then chemicals are chemicals. So these are just nutrients that are found in plants. Now these are everything from like, kale and chard to kohlrabi to, Chinese cabbage. Or, the least nutritious is the head lettuce, of course, right? Very little green, so very little nutrition. The darker the green, the more rich the color and texture, the more nutrients that are in there. And that's really how you should think about food, just like when we talk about eating the rainbow, right? On Raw Week, we're talking about eat raw, right? Eat lots of varieties, eat the rainbow, because all those colors have different nutrients. So we really want to focus heavy on the green nutrients. All those phytochemicals that are synonymous with dark, rich leafy greens. So the main ones, even though we don't have like an RDA for greens, you're supposed to eat 5 servings a day of fruits and vegetables, but the reality is that greens are the staple and very powerful medicine. And nowadays you can kind of say that fruits and vegetables cure 80% of all cancers. Well, in a nation where the rate of cancer is expected to be 1 in 1 for children born after 2010, for everybody else is 1 in 2, that's pretty big time stuff, right? That's very curative things. Even 75% of smokers can cure their cancer with just fruits and vegetables, and not that much. Right now it's up to about 13 servings, which again, a serving is a handful. So whatever fits in your hand is a serving for you. So a big apple, 2 servings. A banana, 2 servings. A little cutie, 1 serving. So you're only talking about 6 large fruits or 6 large vegetables. So 12 servings, 13 servings, sorry, 13. Baker's dozen. So you get lots of vitamin A in these. You get lots of vitamin E. These, again, are going to be the most nutrient dense when they're fresh, when they're vine ripened, when they're picked right from the ground when they ripen. So again, the more cooking we do with these, the less nutrition you're going to have. But then again, a little tiny bit of cooking for greens actually releases a lot of nutrition. So you want to cook them a little bit, not too much. It's also very, very rich in calcium. Again, that's why a cow can eat salad all day long and have bones 3 times stronger than us, right? That's why chimpanzees don't drink dairy and they get their calcium from fruits and vegetables and greens, lots and lots and lots of greens, and there's no problem with them getting fractures, right? Because they're very rich in calcium. And we talked about that before on the meat myth and the dairy myth, right? Thiamine is very important for this. Riboflavin is very important for this. Again, that's part of the flavonoid package. Magnesium is probably the most therapeutic part of greens. This is like the best reason to eat greens, okay? So patience is all the time. You got to do greens because magnesium is going to help your mood, your sleep, and your bowels to work, right? And basically that's all that really matters. And if you think about chlorophyll or green blood or plant blood, right? It's interesting that the tetrahedral structure in there that holds the magnesium is no different than the one that's in our blood. It's actually going to hold iron and make our blood red. In plants, it's green, so it's going to make the plant green. It's going to make their blood green. So when you're eating that plant, think, oh man, I'm eating plant blood and I'm building my blood, and it's going to help me prevent any kind of anemia issues too, let alone it's going to help me poop better, it's going to help me sleep better, it's going to help my muscles relax, and I'm going to feel a lot better, right? So that is a very powerful minimum. That's why we're always talking about green drinks, green drinks. You know, take your greens, grind them up with some fruits and vegetables in a blender, and just have green smoothies, and you're going to feel great right away. And that's why. It's because that big hit of magnesium that's in there. Iron is a very good big part of it, right? Iron with the tetrahedral, that's awesome, because that's really going to be just your building blocks to build the whole thing, so that it prevents the iron deficiency anemia, even megaloblastic anemia. It's great. Also, your B vitamins, you know, that prevents either macrocytic anemia or the beginning stage of normocytic anemia. So the iron and the B vitamins are great for your blood cells in there. And then, of course, fiber. It's rich in fiber. And while you don't digest the fiber that much, it actually binds to sugar in the rest of your diet. And 80% of sugar in fruits and vegetables bind to undigestible fiber. And that creates something called fructooligosaccharides. And you might actually know this better as prebiotics. And what prebiotics are is food for the bacteria, right? The good bacteria, that 750 different species of bacteria that live in and on you. And again, as we said before, as human as you think you are, you're only 1/10 human. For every cell in your body, only one is human. 9 out of every 10 cells is bacteria. So you are just this bacteria transport system, basically. And that bacteria is awesome, right? It protects you against colds and flus and infections. And it's only when those bacteria are not in sufficient amounts, or we eradicate them and don't replace them, that we end up with chronic infections. Now, the best thing, of course, is that lower end, which is, or the thing that we talked about before, which is the phytochemicals. And those are great. So with phytochemicals, again, the darker the leaf, the better. So the type of greens we're talking about are things like bok choy, broccoli, collard greens, chard, and rainbow chard, right? All those different kinds. Kale is awesome, of course. Kale is like the big thing. It's like the quinoa of the dark leafy greens. Mescalin's pretty good too. Mustard greens are great. Beet greens are great. Sometimes you have to go to the health food store for those. But really, you can go out in your yard, as long as you don't use chemicals that have pets peeing and pooping everywhere. You can get dandelion greens, which are awesome for you. You know, the stem has a little medicinal thing that you can put on scratches. The yellow part you can make into a wine. And then the greens you can eat. And then the root you can roast and make like a coffee type of thing. So it's wonderful. It's not a weed, right? It's a medicinal powerhouse. But spinach is probably the most easy one to transition to. It tastes a little bit sweet, and it's very easily digestible. The other hardcore, like, you know, vegan kind or vegetarian type of greens, that, you know, the kale and mustard greens, those are a little bit more hardcore. So, you know, start easy. Just find the ones that you like. Turnip greens are awesome. And of course, watercress, which is a little bit lighter, has wonderful medicinal values. That's a little bit harder one to really buy. You're more likely to find that like along creeks and rivers and that kind of thing. We had it in our store a while back, but it wasn't very good. So otherwise, if you eat watercress that's in season, it's really good. So that would be the least of all those. So what do these phytochemicals do? Why should you care outside of getting these nutrients and vitamins and minerals and you're pooping and sleeping and everything's better? Well, the phytochemicals are the ones that prevent and inhibit cancers. You probably know Brassica Foods. Brassica Foods are like your powerhouse, like every anti-cancer diet there is. Brassicas are like the basis. And much of your healthy greens are going to fall within that brassicas. So brassicas, think cruciferous vegetables, think crunchy vegetables. So like broccoli and cauliflower, but you know, cruciferous greens too. So you have your kale and your spinach and those kind of things. So usually I always think about them a little bit tougher, a little bit more fibrous kind of things when I think cruciferous vegetables, but they all fall in that. So they also deplaque arteries, which is awesome because, again, in America, we talk about, oh, all these things that cause plaque in your arteries, but we never say, how do you deplaque your arteries? Again, if we look at Americans and what Americans should eat, and you say, well, eat more European, but then your cardiologist says, oh, if you eat like them, you're going to get heart disease. Well, they have 70% less heart disease because not only are they eating things that may plaque your arteries up, but they're also eating things that deplaque your arteries. And that's a discussion we never have within the cardiovascular treatment for patients, right? So lysine and omega-3s and plants, all those things, when we eat them, we're just constantly deplaquing and fixing those arteries. So if your diet is deficient and you're just eating crap, you're going to plaque up and cause it, right? But if you want to uncause it or reverse it, you can. And we've actually seen patients that had pre and post Dopplers on the carotid arteries, and you can see that the plaque's all gone. So it's definitely provable. And of course, back in 1972, the first major studies came out that you could actually deplaque arteries, reverse heart disease, even for unstable angina patients that are on the bypass graft waiting list. It only took 2 weeks to get them asymptomatic. It only took a month before they're no longer surgical candidates. But it's not a miracle. It's just what we're supposed to be eating. The body's designed to deplaque these arteries. You just got to feed it what it needs. Now, some of them actually act like antioxidants, and of course, antioxidants, the whole fight of the body is between oxidation and antioxidation. So oxidation is oxidizing and making us older. My first car was a 1964 Corvair Monza Turbo. Probably don't know what that is, but it had like a rear helicopter kind of engine and it had dual carbs. It's a really cool kind of car. But when I would go buy parts for my car, I'd have to go to the junkyard or the graveyard, right? And then it occurred to me, there's cars that are mint condition that are worth more now than when they were first made. There's my car, which runs when I was 16, right? And then there are all these that are in the graveyard. And the only difference is how they maintained oxidation. They treated that car like it was important. They made sure that to reduce oxidative damage. And it's the same thing that we have to do all day long, every day. And that's why the shorter lifespan, the shorter shelf life something has, the more vine ripen. If you don't eat it, it's going to go bad. That is oxidation, or antioxidants. That is the powerful antioxidants. Of course, you look at something like turmeric and ginger, which are very shelf stable. You put them in the freezer for a long time. They actually are 100,000 times more antioxidant than vitamin A, C, or E, just because they are NRF2 factors. So very powerful medicine. So one of the things that one of the say nutrients or phytochemicals that we would like to talk about is carotenoids, right? Carotenoids are pretty cool. You typically think of orange things like carrots and oranges when you think carotenoids, but you have alpha, beta, gamma, delta, and they're actually found in green leafy vegetables. So even though you typically think orange, that orange is masked by that dark green chlorophyll. And so spinach and romaine and those dark leafy greens are going to be full of carotenoids. And again, very powerful medicine for your eyes, right? Have you ever seen a blind rabbit, right? No. So I don't know. It should be good. So anyways, very powerful with the eyes. I was just trying to think. I have 2 rabbits at home, and I don't feed them any carrots, but I feed them greens. Benefits for that, for carotenoids, again, very powerful antioxidants, so anti-aging medicine. They're also very pro-vitamin A activity, which means powerful for prevention of eye problems. So one thing you never talk about, or most doctors don't ever talk about, is how to reverse cataracts. Once you have them, great. How do you reverse them? If you have macular degeneration, how do you reverse that? These are all reversible things because they're all just oxidative damage buildup. That's all they are, right? And so all you got to do for things like glaucoma or cataracts or MAC is basically just enrich the body with antioxidants, and as those cells turn over, they turn over better cells, and then things reverse. Very powerful. And of course, they're preventing cancer, because cancer is just accumulation of oxidation in tissue. Now, the other really good, yeah, there's more, but the other really good one for your eyes is lutein, right? You guys probably know about lutein. But green leafy vegetables, especially spinach and kale and turnip greens and romaine and collard greens, man, they are just packed full of lutein. So these are going to be the really good ones for macular degeneration prevention. Even if you have it, it can reverse it. Same thing with heart disease, the same thing with cancer. Lutein is a very good bang for your buck phytonutrient that's in lettuce. Quercetin, I love this one. I usually use it for like anti-edema. It's really rich in apples and onions. So of course an apple a day keeps the doctor away, you know, or apple a day keeps inflammation away. It's also very prominent in kale. And so kale, which is like, you know, again, the foo-foo green of the day kind of thing, is very powerful with quercetin to reduce cancer, reduce heart disease, and even work on allergies. So again, how about I just eat a constant antihistamine as a part of my diet, and then I don't have to worry about when my histamines are too high and what medication side effect do I want. So we want to eat our way out of histamines. We want to eat our way out of cancer, eat our way out of heart disease, and that quercetin is a big part of that. Don't forget the apples and onions in there too. Very good. The sulfur part of cruciferous vegetables is also a very big part of anti-cancer diets. I mean, that's one of the biggest ways to reverse cancer is through cruciferous vegetables because of the sulfur donation there. Sulforaphane is the main phytochemical that's going to contribute that sulfur. And that's why you see things like garlic and all those kind of things really help with that. Because again, they're heavy sulfur. MSM, people take that for pain. The sulfur, it doesn't matter where it comes from. So you want to eat fruits and vegetables and lots of greens that actually have that phytonutrient to contribute. So, you know, the World Health Organization, they don't really have much for recommendations on greens, which they really should. Greens should have its own category, but it just doesn't right now. So for the cleaning challenge or for just eating healthy every day, you got to have that base of greens in there. And you know, they only recommend 5 a day for the very basic, or 5 to 9 servings, but really your goal should be 13 servings of fruits and vegetables, nuts, seeds, berries, legumes every day. Mostly fruits and vegetables and greens, right? So that's fine. It's going to be very easy if you have a meal and you're having, say, three sides with that meal. Then by the end of the day you got 9, a couple snacks in there, an apple and a banana, and you got yourself, you know, 13 servings easy. So it shouldn't be that hard. And really, again, don't think American proportions, think European proportions. That handful of fruits, vegetables, or greens is a serving for you. So a child serving is a different size versus a 6'4" man serving versus a, you know, a 4-foot woman serving. So you want to think appropriate serving size for that. Another way to really get more phytonutrients is to kind of view those fruits and vegetables as snacks. You know, a lot of times with patients, we're always wanting to do kind of nuts and seeds as snacks because they're just powerful antidepressants and mood stabilizers. But fruits and vegetables are awesome. They're portable, they're fast food. I know, like at our quick shop here in town, they started carrying fruits and vegetables. Again, maybe they're not organic, but it's a hell of a lot better than chips, right? And that's one of those things I want to emphasize in the very end of this. Oh, which by the way, I learned that if you don't get dressing on your salad, if you want to get a salad through the drive-thru, you can actually just set that bowl next to you or that container and just use your hands and eat that stuff while you're driving, okay? So there's still no excuse to say, oh, I gotta have a burger or fries because they're easier to eat. Man, if you spill that lettuce on your shirt, you're not gonna mess it up, so it's great, right? So that's better. All right, so I want to thank you guys for listening to this. Check out our other videos, And we have our health tips and our kind of life or cooking hacks available too. And I have a lot more videos on YouTube too about food as medicine, those kind of things. But this is very powerful. Don't minimize the idea of just what greens will do for you. You know, these are the oil, the gas, the antifreeze, the taillight fluid. These are the things that run your vehicle, and you got to have that bare minimum. There's over 900 phytochemicals that we know of that are in greens, right? Average serving has 100 different kinds of them. Very, very powerful medicine and very simple medicine. And by the way, if you want to grow your own, super easy, right? Kale is very, very stable type of green to grow, very easy, pest resistant, you know. Awesome. So you can grow those in pots or container gardens. You can, have them grow in your windowsills. You don't have to have a whole garden dedicated to them. So I would go about looking at container gardening, square foot gardening, if you want to grow your own. Otherwise, thank you so much for watching the video, and I hope this really helps, and I enjoy talking to you later. Thanks.